Do you know what the electrocardiogram exam is? Also called ECG or EKG. Let's learn with us in this video. The ECG records the electrical activity of a large mass of atrial and ventricular cells, not that of just a single cell. Because cardiac depolarization and repolarization normally occur in a synchronized fashion, the ECG is able to record these electrical currents as specific waveforms: P wave, QRS complex, ST segment, T wave, and U wave. The spread of stimuli through the atria and ventricles, followed by the return of stimulated atrial and ventricular muscle to the resting state, produces the electrical currents recorded on the ECG. Furthermore, each phase of cardiac electrical activity produces a specific wave or complex. The basic ECG waves are labeled alphabetically and begin with the P wave. The P wave represents the spread of a stimulus through the atria, atrial depolarization. The QRS complex represents stimulus spread through the ventricles, ventricular depolarization. The ST segment and T wave represent the return of stimulated ventricular muscle to the resting state, ventricular repolarization. The U wave is a small deflection sometimes seen just after the T wave. It represents the final phase of ventricular repolarization, although its exact mechanism is not known. The PQRST sequence represents the repetitive cycle of the electrical activity in the heart, beginning with the spread of a stimulus through the atria, P wave, and ending with the return of stimulated ventricular muscle to its resting state, ST T sequence. This cardiac cycle repeats itself again and again. So, what does a normal ECG look like? A normal ECG should have a consistent and regular waveform with no abnormalities. The P wave should be upright and of similar size and shape for each heartbeat. The QRS complex should be narrow and pointed, and the T wave should be upright and of similar size and shape for each heartbeat. If your ECG results are abnormal, it may indicate that there is an issue with your heart's electrical activity. Abnormal ECG results can include irregular heartbeats, changes in the size or shape of the waveforms, or the presence of additional waveforms. The PQRST sequence is recorded on ECG graph paper, which is divided into small grid-like boxes. Each small box is 1 mm square and the paper usually moves at a speed of 25 mm/second. Horizontally, each unit represents 0.04 sec, and the lines between every 5 boxes are heavier, so each 5 mm unit horizontally corresponds to 0.2 second. The ECG can be considered a moving graph that horizontally corresponds to time, with 0.04 second and 0.2 second divisions. Vertically, the ECG graph measures the voltages or amplitudes of the ECG waves or deflections. The electrocardiograph is standardized or calibrated so that a 1 mV signal produces a deflection of 10 mm amplitude. The standardization can be set at 1/2 or 2 times the usual calibration. Because the ECG is calibrated, any part of the P, QRS, and T deflections can be described in 2 ways. The amplitude or voltage and the width or duration of deflection can be measured. A wave or deflection is also described as positive or negative, and a deflection that is partly positive and partly negative is called biphasic. How to calculate your heart rate from an ECG reading? 2 simple types of methods can be used to measure the heart rate, which is the number of heartbeats per minute from the ECG. The first method is called the box counting method. This is the easiest way to measure your heart rate when it is regular. Count the number of large boxes between 2 successive QRS complexes and divide 300 by this. For example, in this ECG reading, the heart rate is 75 beats per minute because 4 large time boxes are counted between successive R waves. When the heart rate is fast or must be measured very accurately from the ECG, you can modify the approach as follows. Count the number of small boxes between successive R waves and divide 1,500 by this number. In this example, 20 small time boxes are counted between QRS complexes. Therefore, the heart rate is 1,500 divided by 20, resulting in 75 beats per minute. If the heart rate is irregular, the commonly used box counting method may not be accurate. This is because the time intervals between QRS complexes can vary from beat to beat. However, there is a simple alternative method that can be used to determine the average heart rate, whether it is regular or not. This involves counting the number of QRS complexes in a convenient time interval, such as every 10 seconds, which is the recording length of most 12-lead clinical ECG records. You can then multiply this number by an appropriate factor to achieve 60 seconds, typically 6, to obtain the heart rate in beats per minute. It's important to note that a heart rate exceeding 100 BPM is referred to as tachycardia, while a heart rate slower than 60 BPM is called bradycardia. These terms are derived from the Greek words tachys, which means swift, and bradies, which means slow. During exercise, your heart rate will likely increase and you may experience sinus tachycardia. Conversely, during sleep or relaxation, your heart rate may drop into the 50s or even lower, indicating a sinus bradycardia. And that's it for today, folks. Thank you so much for watching this video and joining me on this healthy journey. Please subscribe to my channel to stay updated on upcoming videos and courses. We hope to see you in the next video.